Hello, I'm Glenn W. Hunter, and with me today I have Dr. James George of Excel Physical Therapy and Wellness. And today's topic is knee pain. I'm going to jump right in, Dr. George, and let you start sharing some of the wisdom that you have regarding this important topic. Uh, as we know, knees are very intricate, and as a result of that, does most knee pain start with bone, ligaments, cartilage, or tendons?
Knee is a very unstable joint, and it is an intricate joint. The reason is, there's two bones, actually three bones: the tibia and the fibula, and there's the femur. But the tibia and the femur is the one which actually articulates. Now, there's not much support joint-wise or bone-wise. It's the ligaments around this knee actually, which is supporting the knee actually. All right, so there are ligaments on the side. So this inside of the knee is called the medial collateral ligament. The outside is called the lateral collateral ligament. And inside the knee, we have two main ligaments called anterior cruciate ligament and posterior cruciate ligament. Now, typically injury to these ligaments are the main reasons for knee pain. Main reasons, of course, osteoarthritis, injury to the patella, the kneecap, and the muscles, the quadriceps or the hamstrings, or the calf muscle. These are some of the reasons for people ending up in having knee pain, but the main reason is the ligamentous injury, because the ligaments are the ones which hold the knee in position. And if there is any injury to the ligaments, that causes instability in the knee, and that causes knee pain as well.
You mentioned at the end about instability, and sometimes that can be a byproduct of guys like me maybe eating a little more than they should. How would you describe the relationship between obesity and knee pain?
Well, we all know that there is a research actually supporting obesity and osteoarthritis. There is a primary osteoarthritis and secondary osteoarthritis. But what we know is people who have increase in body weight, the knee has to take that increase in body weight, and that causes compressive forces on the knee and actually shearing forces as well. And the bone in the knee, in the joint, actually is covered by cartilage, and this cartilage wears off, resulting in people ending up having a knee pain. And the best way is, one of the reasons is people who are obese also, they're not exercising good enough, so the muscles around the knee are not strong enough to support the knee well. Not only the knee, the muscles around your hip also play a vital role in actually preventing and maintaining a healthy knee. So exercising to decrease body weight, like aerobic exercise or even aquatic exercises, can actually relieve some pressure off the knee and help actually decrease pain and even maintain a healthy knee.
Outstanding. So there is hope. But another component of it, what about heredity? How does that play into knee pain?
Well, yes, hereditary. A lot of hereditary problems of especially the hip, can cause problems in the knee. If you look at whichever way the hip goes, the hip joint moves, the knee has to give. Not only that, whichever way the ankle goes, the knee has to work around it to be able to perform well for a person to walk or run. So the hereditary conditions like avascular necrosis, Perthes disease, or slipped capital femoral epiphysis of the hip can cause knee issues. And there are like a softening of the tibial tuberosity, or even there are some hereditary problems where people's cartilage actually, it just comes off, because of the softening of the bone, and they do not have like a healthy cartilage tissue, all these things can cause knee issues, and we found that we also know that there is a strong correlation between people having osteoporosis or osteopenia, and that is also hereditary as well, and that can cause knee pain as well. So there are umpteen reasons, hereditary wise, also people ending up in having knee issues.
I see. I see. So yeah, with some man, with all these different influences on it, I have yet another one. What about the relationship between knee pain and old age?
So people think as you get older, hey, you're going to have knee pain, and when people complain of knee pain, they say, hey, you're old, that's why you have knee pain. Actually, if you start a good physical therapy rehabilitation program in your middle age, in your 40s and 50s, you can have a healthy knee, going into your 60s, 70s, and 80s. It's all about performing proper exercises, on a proper treatment protocol, rehabilitation protocol, to strengthen the knee muscles and also the ankle muscles and the hip muscles, which in turn will keep the knee healthy. And you can actually prevent ending up in having severe knee pain in the old age.
Wow. Okay. On the other side of the equation, though, young people also can experience joint pain. What seems to be a leading trigger for that problem?
Yeah, many times young people, they want to get into a go to the gym or start a new active lifestyle, which involves getting to a new sports. So what happened is these muscles, the muscles in your legs, the legs are not conditioned. They haven't been exercised before properly before they start this new gym program or the sports program. So what happens? That causes the knee pain and even hip and ankle pain. So going to a physical therapist and getting finding out whether there's any kind of tightness of muscles or weakness of the muscles in the legs, get that addressed, and then getting into a gym program or a sports program would be advisable. So many times tightness of certain group of muscles and weakness of certain group of muscles and the way you walk or even run, if there are abnormalities in the way you walk and run, that is causing issues in the mechanics of how your leg moves. That is a predisposing factor for somebody to end up in having knee pain or hip or ankle pain. So yeah, consulting with a physical therapist before you start a new exercise regimen or sports activity is a good idea.
Okay. So fundamentally, in your practice, patients you see, what seems to work best in alleviating knee pain?
As we discussed before, it's about being evaluated, having a thorough evaluation from a physical therapist to find out whether there's a tight, certain groups of muscles which are tight, or muscles are weak, or if there is any nerve tightness, or if there is any ligamentous laxity, or if there is any biomechanical abnormalities in the way they walk or run. This evaluation needs to be done and needs to be addressed, and that could help in decreasing knee pain. So when you come to our office, we perform a thorough physical examination and history taking and a subjective examination, finding out there is a chance of a. So we do a biomechanical evaluation, how they stand, their posture, they walk, they run. So, and then if there is any abnormalities in these in this particular movements, so we correct the movements and we actually help teach some remedial exercises. That way we can even prevent, or even if they have knee pain, we can actually decrease the knee pain.
Okay. Okay. Because knees are essential to mobility and stability, um, do ankles, hips, or backs ever play into triggering knee pain?
Yes, yes, that is a very important question. Many people, like they, when there is a knee pain, they think it's the problem is coming from the knee alone.
Mhm.
Many times, the ankle issues. See, whenever you walk or run, it's the foot which actually touches the floor first. When there is any issues in the ankle or the foot, that could cause knee issues. And if you have any issues in the hip or the back, that could cause knee issues as well. So performing a thorough evaluation and finding out what is causing the knee pain is very important. And then once we make a physical diagnosis, we make a treatment protocol for rehabilitation, and that will help decrease the knee pain. So it's all about a thorough evaluation.
Wow. So, I mean, clearly there's a lot that goes into having a healthy joint down in that part of your legs, having healthy knees. Um, when you start thinking particularly about some of the elderly that you serve, what remedies do you suggest?
So what is important is as people in their late years of their life, they should start. Either they should have started their exercise in the middle age, but still it's not too late. They should start exercising. Exercising in the sense they would ask, hey, I already have knee pain. I cannot walk. I cannot do any activities. Then you come to a physical therapist. We help decrease the knee pain, and we start on an exercise protocol, and then we help you go into a walking program, or some like a bike exercise program, where you can perform your exercises without knee pain. So if you already have knee pain, it's better you come to a physical therapist, get treated for the knee pain, and we actually will help you go back to an exercise program. So yeah, performing exercises is a very important aspect of helping decrease knee pain, and even maintaining your knee, a healthy knee, and preventing knee
Well, I tell you, Dr. George, this has been incredible considering that, here in the Inland Empire, there are a lot of people that focus on having a healthy lifestyle. Exercise is part of the good weather that we have here. And I think what you've been able to provide today will allow people to continue to strengthen themselves physically without, well, basically just by easing some of the tension that they be experiencing in their bodies currently. So I thank you for sharing that wisdom. But more importantly, how do people get a hold of you? Because I think they're going to want to follow up with some of the tips that you've provided.
Yes, you can reach us at Excel Physical Therapy and Wellness. Our number is 909-792-5050. You could also visit our website, excelrehabandwellness.com. You can Google us at Excel Physical Therapy and Wellness, and you find all the information in Google about our practice. Thank you.
Indeed. Again, Dr. James George, Excel Physical Therapy and Wellness. And I think that he is able to provide some information today that will help people live more fulfilling lives and definitely healthier and pain-free lives. Dr. George, I thank you.
Thank you, Mr. Glenn Hunter.